actually think it's a good thing if we deregulate from the point of view of the availability of supply for aged care. Now, we're doing it as far as home care is concerned from February 2017, and I think that's fundamentally a good thing, and it will drive quality from the point of view of home care. The next step is actually making it possible in residential aged care to have, if you like, uncapped supply or availability. It's really important for us to recognise that we can have quality indicators, we can have standards, we can sort of regulate compliance, we can look at clinical indicators and all of that sort of thing. But at the end of the day, if there's only so many places where we can get the care that we need, then that's always going to restrict the improvement in quality, the improvement in innovation. And if we give the person who requires the care, be they in their own home or be they requiring residential aged care, we give them the licence, for want of a better term, to receive that care, to receive that subsidy, then you can have 50,000 more places than you have today. But people will then be able to go to the place that they actually like and the place that is actually their choice. When you have occupancy levels in residential aged care that are in the 90% type number, that's not really delivering true choice. That's a bit like saying I can hop on a plane to go to England, but there's only one airline and they only have one seat available for me. Well, people are saying, how are we going to navigate and have new sort of quality indicators? My answer to that would be that we've already got quality of care indicators. They're called the accreditation standards. There are 4 standards. There are 44 expected outcomes. They're actually the quality indicators that we've had for the last 15 years, but they're quality of care indicators. They're not quality of experience, quality of life indicators. The quality of life indicators are more challenging to do because quality of life, what I believe is quality in my life, your idea of what quality of life is for you, that's irreducibly a subjective matter. The best way I think to do that is, some people have referred to things like TripAdvisor. Now, I'm not saying that it should be like TripAdvisor. I think it should be a more moderated form of that. In the UK and also in some Victorian, in Australia, services, in hospitals, they have patient opinion, which is a moderated website that people are talking about their experiences, and it's moderated so that you actually get a chance to respond if you're the hospital. And there's also a similar website called Carer Opinion. That's the sort of thing I think we should be looking at. So when people are actually asking or receiving feedback, sometimes people are fearful about that. I don't think they should be. You might as well not die wondering about what people are actually thinking about your service or how you can improve. Sometimes the people who have had the greatest complaints about a service become your greatest fans because you've addressed the issue. I believe it's not. I believe that in a complaints and a compliments process, it's 10% of what the complaint and compliment is, and it's 90% of what you do about it.